I was 28 when the tremors started. Not nervous shakes, full-body tremors that made holding a coffee cup impossible. By month 3 I couldn't type without my fingers seizing. By month 6 I was collapsing in grocery stores. The diagnosis came on a Tuesday: early-onset Parkinson's disease, aggressive progression. Dr. Chen, one of the country's leading movement disorder specialists, explained that without immediate intervention, deep brain stimulation surgery, intensive therapy, and a new medication protocol, I'd be in a wheelchair within 2 years. The treatment is extensive, she said. But you're young. If we act now, we can slow this significantly. The cost was staggering. $70,000 out of pocket, even with insurance. I just started as a software engineer at a mid-sized tech company. I had savings, but not that kind of money. I called my mother that evening. She was director of nursing at Riverside Medical Center, one of the state's most prestigious hospitals. If anyone would understand the severity, it would be her. Parkinson's? At 28. Her voice dripped skepticism. Are you sure they didn't misdiagnose you? Mom, I've seen 3 specialists. They all confirmed it. What do they want to do? I explained the treatment plan. There was a long pause. That seems excessive, Rebecca. You're so young. This is probably just stress. Have you considered a vacation? My hand tremored so hard I nearly dropped the phone. Mom, I can barely hold a fork. I think you should get a 4th opinion. These doctors always want the most expensive option. She promised to look into it. I sat on my bathroom floor, crying so hard I triggered another tremor episode. 3 weeks later, she called to invite me to my sister Melissa's engagement party. It's at the country club, Mom said brightly. Melissa wants you as a bridesmaid. Spring wedding, so dress fittings start in January. Mom, did you look into the treatment plan? Oh, Rebecca, let's not talk about that now. This is Melissa's special time. Besides, you seem fine. You're still working, aren't you? I was working from home barely. Taking breaks every hour to lie down when tremors got too bad. I'm not fine, Mom. I need this surgery. Surgery seems very dramatic. Your father and I can help with some costs, but $70,000? That's more than Melissa's entire college education. Maybe look into payment plans. Dr. Chen says if I don't start treatment now. Dr. Chen doesn't know everything, sweetheart. I've been a nurse for 30 years. Sometimes specialists exaggerate to justify their fees. Let's get through Melissa's engagement party first. The engagement party was torture. I wore long sleeves despite the heat, hiding the tremors. My mother introduced me to relatives with the same line. Rebecca's doing wonderfully. Still at that tech job making good money. When Aunt Patricia asked why I looked so thin, Mom laughed it off. She's always been the picky eater. I watched her fawn over Melissa, who'd gotten engaged after 6 months of dating. The wedding budget was $90,000. My parents were covering half. We want to give Melissa the wedding she deserves, Dad told his brother loud enough for me to hear. She's worked so hard. I excused myself to the bathroom and collapsed, legs giving out. It took 20 minutes to stop shaking enough to stand. Build up. Over 3 months, everything deteriorated. I took medical leave from work. My savings drained covering basic bills. I called my mother weekly begging for help. Rebecca, we've committed to Melissa's wedding, she said. We can't pull that money. Besides, you're young. You have time. Mom, Dr. Chen says every month I delay makes it worse. Maybe Dr. Chen is overly cautious. Have you tried yoga? I've read yoga helps neurological issues. I started documenting everything. Every phone call, every dismissal. I kept a detailed medical journal with timestamps. Dr. Chen's office helped me compile complete medical records. Diagnostic tests, specialist consultations, treatment recommendations, and notes about my family's refusal to assist despite their financial ability. When Melissa's bachelorette party came, I was too sick to attend. Episodes 3 or 4 times daily where I'd lose muscle control entirely. Mom called the next day. Melissa was very hurt you didn't come. Everyone asked where you were. I told them you were dealing with minor health issues, nothing serious. Minor health issues? Mom, I have Parkinson's disease. Well, I can't tell everyone that. Sounds so severe. People will worry. Honestly, Rebecca, maybe if you got out more, stayed active, you'd feel better. That's when I heard it, voices in the background. She was at a family gathering. Is that Rebecca? My grandmother's voice. How is she? Mom's voice shifted to that sympathetic tone she used with patients' families. She's having some health issues, but nothing too serious. You know, Rebecca always been dramatic about these things. The doctors want expensive treatments, but I think a lot of it is optional. So, she called my treatment optional. I hung up and immediately called Dr. Chen's office. If someone with medical authority, say a director of nursing, told people a confirmed Parkinson's diagnosis was optional treatment, would that be negligent? Pause. That would be serious. Especially with medical training. What if I had documentation? Dr. Chen would want to see that. I sent everything. Every text, every voicemail, every journal entry. Dr. Chen called personally 2 days later. Rebecca, I'm horrified. With your permission, I'd like to bring this to the hospital ethics board. Your mother works at Riverside Medical, correct? Yes. Director of nursing. Then this is especially concerning. She's in a position of authority. For her to minimize a serious neurological condition, especially to family members relying on her medical judgment, this could be professional misconduct. I gave permission immediately. Within a week, my mother called, voice shaking. What did you do? I documented everything, Mom. If it's not documented, it didn't happen, remember? The hospital is investigating me. They're saying I provided negligent medical guidance. This could destroy my career. You told everyone my treatment was optional. I didn't mean, I was being realistic about costs. You spent $90,000 on Melissa's wedding. You told Grandma I was dramatic. You said my Parkinson's was minor health issues. I'm your mother. You're also a medical professional who used your authority to convince family I was exaggerating a serious illness. Dr. Chen says every month I delayed made my prognosis worse. Silence except her breathing. The board wants you to testify, she finally said. I'll be there. Revelation. The hospital ethics board met on Thursday. Dr. Chen presented my case. Complete medical records, treatment recommendations, and documented disease progression over 6 months of delays. Then she presented evidence of Mom's statements. Voicemails calling treatment excessive, texts telling me to try yoga, and the recording from the bachelorette party where she told my grandmother and 3 aunts my treatments were optional, and I was being dramatic. Linda Morrison is telling family members, some who may make medical decisions based on her professional authority, that a confirmed neurodegenerative disease requires only optional treatment, Dr. Chen told the board. She actively discouraged her daughter from life-altering medical intervention while spending $90,000 on a wedding. The board launched a formal investigation. Within days, it spread beyond Riverside Medical. Dr. Chen sat on the State Nursing Association board. She'd shown my case to colleagues who were appalled. The hearing was held in Riverside's administrative conference room. I sat across from my mother, who looked smaller than I'd ever seen her. Her attorney kept glancing at the evidence folder like it was radioactive. Dr. Chen presented medical facts. I presented documented dismissals. The board asked direct questions. Ms. Morrison, did you tell your daughter her prescribed Parkinson's treatment was excessive? Mom's face paled. I was concerned about cost. Did you tell family members her treatment was optional? I didn't want to worry them. You're director of nursing at this facility. Family members would assume your medical assessment was accurate. Did you explain the severity of early-onset Parkinson's? Silence. The board chair leaned forward. Ms. Morrison, we've reviewed your daughter's records. Dr. Chen's plan was aggressive but medically necessary. Your daughter's disease progressed significantly during the 6-month delay. If you'd provided this guidance to a patient's family, we'd consider it grounds for immediate termination. My mother tried to speak, but her attorney touched her arm. The board will deliberate, the chair said. Ms. Morrison, you're suspended pending our decision. 2 weeks later, the decision came: termination for conduct unbecoming of a medical professional and providing negligent medical guidance resulting in harm. The State Nursing Association launched their own investigation. She kept her license but with a formal reprimand on her permanent record. Any future employer would see it. Resolution. My father called once, voice cold. You destroyed your mother's career. She told everyone I was faking it while I was losing the ability to walk. She's your mother. You could have handled this privately. I tried for 6 months. She chose Melissa's wedding over my treatment. He hung up. I haven't heard from him since. Melissa sent one text. Mom lost her job because of you. Hope you're happy. I didn't respond. The story spread through medical circles. My extended family started calling. Grandmother, aunts, cousins. They'd all believed Mom's assessment that I was exaggerating. Now they knew the truth. Some apologized. Some stopped speaking to me entirely. I used my remaining savings and took loans to start treatment. The surgery was scheduled for the following month. Dr. Chen personally oversaw my care. You shouldn't have had to fight your family for this, she said during pre-op. But I did. And I documented it. 3 months post-surgery I was back at work part-time. Tremors hadn't disappeared but were manageable. I could type, hold a coffee cup, walk through stores without collapsing. My mother sent one email 6 months after termination. Hope you're doing better. I'm at a clinic now. Fewer responsibilities. I've had time to think. No apology. No acknowledgement. Just a status update as if she'd given bad advice instead of nearly destroying my chance at a functional life. I deleted it without responding. Last week I ran into Mom's former colleague at a coffee shop. She recognized me, face full of sympathy. The whole hospital knows what happened. I'm sorry your family put you through that. Thank you. Your mother was always proud of being director. Losing that destroyed her. I held my coffee cup with hands that only trembled slightly. She made a choice. She dismissed my medical crisis while planning a $90,000 wedding. She used her medical authority to convince family I was exaggerating. Those were her choices. The woman nodded. Still, it must be hard without family support. It is, I admitted. But I have doctors who believe me, treatment that's working, and documentation of everything. That matters more than people who called my brain surgery optional. I left and drove to Dr. Chen's office for my quarterly checkup. Walking through hospital corridors, steady, stable, functional, I thought about Mom at some small clinic, prestigious position gone, reputation ruined. I didn't feel guilty. She'd had 6 months to take my diagnosis seriously. She chose image over my health, Melissa's wedding over my survival. The medical records didn't lie. The hospital board saw exactly what happened. A medical professional who used her authority to minimize serious disease because treatment was inconvenient and expensive. She made her choice. The consequences just caught up. I was 29, working again, managing my condition, building a life despite my family. Some might call me vindictive for documenting everything and presenting it to the ethics board. I called it survival. And unlike the treatment my mother deemed optional, that was non-negotiable.